Welcome back to the Trauma Therapist Podcast. My name is Guy McPherson. My mission is to raise the awareness of trauma and to support and inspire new trauma therapists just starting out on the trauma-informed journey. I do that with my membership community, Trauma Therapist 2.0, my online courses and workshops, and the Trauma Therapist newsletter. If you're a therapist of any kind and you work with individuals who've been impacted by trauma, I invite you to head on over to my website at thetraumatherapistproject.com. That's thetraumatherapistproject.com. All right, let's get started. So 5, 4, 3, 2, and 1. All right, folks, welcome back to the Trauma Therapist Podcast. I am very excited to have as my guest today, Dr. Haim Weinberg. Dr. Weinberg, welcome.
Thank you very much.
You are welcome. So Dr. Weinberg is a licensed clinical psychologist in California and Israel in private practice in Sacramento, California, with more than 35 years of experience. He's also a group analyst and certified group psychotherapist, as well as a past president of the Israeli Association of Group Psychotherapy and the Northern California Group Psychotherapy Society. He published books on internet groups and about fairy tales and the social unconscious, and co-edited a book about the large group and a series of books about the social unconscious. Now, I interviewed someone who was in your group, and this person spoke so highly of you and what you did. And I said to myself, I love to have this gentleman on my podcast. So with that, welcome to the podcast.
Thank you very much. I'm flattered and honored to be here.
Awesome. So before we get going, Dr. Weinberg, share with the listeners where you're from originally and where you are currently.
Okay. Originally, I am from Israel. I grew up in Israel and lived there most of my life. I moved to the US around 17 years ago already, and landed immediately in Sacramento, California. That's where I live nowadays.
Okay. Why'd you move, if I can ask you that?
For romantic reasons. I found my soulmate and the love of my life.
Nice. All right.
Who is also a psychologist and a group therapist.
Oh, interesting. Okay. I'm sure there's more to that story, which we won't get into right now, but how did you get interested first off in psychology, and then let's talk about the specialization of group psychotherapy?
Yeah, okay. So actually, I started as an electronic engineering. I studied in the Israeli Technion, the university for technical engineering, and but I realized that I'm interested in people more than neurons and electrons, and especially in how people connect and what kind of relationship they create. So I started studying psychology and found it wonderful.
What about that? Why were you interested in more about people and how they connected? Why? How?
Well, that's a very good question. I never thought about this question, so I have to think about it. It might be related to difficulties that I went through my adolescent period, and feeling that I have difficulties in being myself, in finding my identity, in connecting stronger with people. So I wanted to understand that, and this led to psychology.
Mm-hmm. So how did things unfold for you? So how far did you go in terms of being interested in neurons and engineering and so forth? Did you go to university and so forth?
Oh, of course. I entered after finishing my degree in electronic engineering. I decided to go and study psychology. Wow. And I studied first for the master degree. In Israel, the master degree is enough to have a license in psychology because it's broader than the master degree in the US. Mm-hmm. And then I studied for the doctorate as well, and became licensed here when I moved here.
Okay. So walk us through how your interest in group psychotherapy blossomed.
Yeah. Well, I think that the first kick that I got was when I went to a very intensive workshop of kind of a long weekend in Israel, in which the best group therapists at that time in Israel gave workshops. And that was such a powerful experience for me. I still remember, I think
Mm.
it was maybe 35 or 40 years ago. And I still remember what happened there, and it simply blew my mind. And I decided, when I grow up, I have to be a group therapist.
Well, what you got to tell us what happened.
Oh, in that place? Well, there were such strong moments. For example, a woman that never had any relationship, and the group facilitator asked me if I'm ready to help her feel more comfortable. And I don't even remember what I had to do, but I also only remember that I had such an impact on her that I felt, wow, this is powerful.
Wow. Wow. So you kind of put on the spot
In that, yeah,
in that,
of course, in that
yeah,
workshop, some of the time, of course,
right,
not all.
right.
Yeah.
Yeah. I mean, in part, the reason why I wanted to have you on here because I love the experience of being in a group and running a group and a, 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 a great facilitator really does something that is incredible. What did you see this person or what did you experience that this facilitator was doing?
Creating a safe space, I think, to be more open, to be more vulnerable, and to interact on a more deeper level. I think that this is what I thrive to do in my groups.
Okay. And well, let's take each of those one by one if we can. So create a safe space. Everyone, okay, we talk about that in this field. How do you do that?
Okay. One thing is by um, keeping the boundaries safe. It can be very simple by saying that confidentiality is kept in the group, but also whenever someone crosses the boundaries, to explore what happened and send the message that it's important to keep the
For
boundaries.
example,
For example, if a group, one of the recommendations in my group is not to have social relationship between group members outside the group. So let's say that someone said, oh, I met with so-and-so, a member of the group. I would say, well, let's see what is the impact and what the motivation, and let's explore that. And usually group members say, I feel jealous. I feel as if I'm excluded. I feel so. It creates a safe place. But it's more than the boundaries. For example, if the dynamics of a scapegoat develops in the group, I intervene in order that it will not go further, not damage both the person who is scapegoated and the other group members. And nowadays, when racial issues occur in the group and microaggressions occur, I intervene in order to point it out and help BIPOC people to feel safe in the group, that it's okay to talk about these issues.
How might you do that?
Let's say that you have some comment to here. I have a group when I have a woman who is biracial and her skin looks whiter than you wouldn't recognize her as having a black origin. So someone said, "Oh, you don't look like a black person." You know, he meant the color of the skin, but I immediately saw the expression on her face, and I said, well, let's stop and see what is happening here. I know that you meant well, but can you, the other person who was offended, can you say how you felt and what the meaning for you? So intervening when I see that group members feel and cannot express their feelings, helping them to express their feelings, for example.
Now that, in my experience, sounds easy, but obviously it's not. I mean, it's almost an art, right? There's a tact involved. There's a judgment. There's a self-trust that has to go on with you.
Yes.
How did you develop that?
Well, it took me years, Guy. It took me years to develop this, and I agree with you, it's art. It's a kind of having a masterpiece expertise. And I'm still making mistakes.
Mm-hmm.
The way to develop it is to really learn from your mistakes. And even though I have the expertise and the experience of, I think, 35 years in group therapy, I'm still learning and I'm still making mistakes. Sometimes I kick myself and ask, what is happening? How come you made this mistake? It's a mistake of a beginner. But the important thing is to learn from it. And
give us an example of a I want to, if you could, give us an example of a recent mistake you've made. And I'd love to hear an earlier one too.
Well, it's not mistakes that I am proud of, but I'll try to. For example, one of my group members is a very active social justice person. And she always fight for, human rights and all of that. Now, even though that's my approach as well, but in the group, when she is doing that in such a general, not in the here and now thing, not between you and I, but as an ideology and philosophy, it triggered me. So I started arguing with her about the way she's doing that.
In the group.
In the group, yeah.
Right.
I was drawn to a kind of an interaction that is not very professional, not in my role, just because she pushed my buttons. And I know now what my buttons are, okay? The important thing, and it was very difficult, fortunately, she was a resilient person. I mean, some people would have left the group because it's clear when the group therapist starts to argue, this is not the place for you. But we were able to work it through and to really mend the rupture. And I think that now we are maybe a year and a half after that. And I think that the situation even became better in the group because people saw that even such conflicts and such mistakes can be repaired.
Right, right. Now, I appreciate you sharing that. And can you share kind of an early clinical error, kind of when you were just starting out, kind of like, a rookie error in a sense?
That's a good question. I think that my recent ones are so fresh in my mind and I'm processing them so much again and again that I'm not sure that I will remember. But I think it's more about not keeping the boundaries of the group well. So, for example, here's an example. In the early days, I had a couple in the group, two members in the group started dating outside the group. And I wasn't aware enough how it affects the group when it was revealed, and I didn't explore it enough. And I think that it was damaging for the group members. They felt excluded, and this couple couldn't work on their relationship really in the group. Nowadays, if I know about that, I immediately start a conversation and a discussion and asking both them and the group members, and maybe even at some point wonder if it's still possible for them to be both of them in the group.
So we're talking about group psychotherapy here. what kind of group do you run?
Okay. First of all, I run what we call a process-oriented group. It's not a psychoeducational, it's not action-directed, it's unstructured, mixed gender, mixed diagnosis, long-term group. However, most of my groups nowadays are especially for therapists. These are online training process groups for therapists from all over the US and even from all over the world. This is my main work today.
So it's an online.
Yes.
Wow.
Yes.
Interesting. Now,
Yes.
I would imagine that obviously there are some challenges that come with that.
Of course, many. But challenges are, from my point of view, wonderful things to work through and to learn how to overcome them.
Do you run in-person groups?
Yes, I also run in-person group. In the pandemic time, of course, they moved to online as well. In the last 2 months, I started back to see them in person, but these are patients groups, not therapist groups.
Now, why, for our listeners here, why would someone want to join a group period, as opposed to, or would they do it in addition to individual psychotherapy?
Okay, so some people start with individual therapy, and at some point after they had a lot of individual therapy, they feel that they want something else, and many of them understand that the group can help them more. Some people do it as a combined therapy, both individual and group at the same time. There are a few people that start with group therapy. Most of the people start with individual. Why would they join a group? Because a group feels more alive. It's very difficult in the group to intellectualize. In individual therapy, sometimes you know already, you talk about, you understand, but it stays in your head. And in the group, it's very difficult to stay in your head. The interactions are so powerful. You are in a relationship all the time, and you work on that. So, yeah.
Yeah, I appreciate that. One of the things that really struck me and inspired me about being in different groups was the immediacy of it.
Yes.
The being called upon, Guy,
Yes.
what do you think? What are your thoughts? How do you feel? What's your response? And I'd be, me? You're in that moment, right? You're called upon to kind of step up. I love that. It's hard.
Yes. And Guy, you point out something very important. I want to add that surprisingly, online, because I see your facial expression so clear and so big, more than even in person, I can say, oh, Guy, I noticed that you have some expression on your face. What does it mean? How do you feel? Can you say it in words?
Right, right. That you might not be able to see if we were
that
actually.
I might, yeah, when someone is on the other side of the room.
Right, right. What does it mean to, I think you mentioned vulnerability. How does that come into play when you're working in a group? How do you invite that? And why is that important?
Well, let's start with the last question. Why is it important? If you want to be in intimate relationship, you have to allow yourself to be vulnerable. What is intimacy? The popular saying is, into me you see, intimacy. Yeah. So you allow the other person to see inside of you. So you become vulnerable. Okay. Now, in a group, actually, because it's all about the here and now, the interaction, what happens to you with other group members, with the leader, it is about how you allow and how you don't allow for more intimacy, for more connection, for more closeness. And immediately you have to touch the question of vulnerability.
Mm-hmm.
Okay. What made you not come to the group last time? I had an appointment with someone. Okay, can you think about why you preferred this appointment to the group? Well, actually, last time I opened up and I felt so vulnerable that I felt that I couldn't come. This is an example of working on vulnerability in the group.
What are some of the when you said that your groups were kind of unstructured? When you sit down, let's say you're starting a group, so it's fresh, all the people are there for the first time. How do you work with that? What do you do?
You are talking about the first meeting, or?
Yeah.
Okay. The first meeting, I simply repeat the agreement. First of all, I meet with every group member before the group for 3 reasons. And that's important, by the way, if you want to become a group therapist, to do that. One is to start a relationship, to bond, to create some therapeutic alliance. Second, to agree about the goals and the tasks. And that's important as well, because therapeutic alliance, including agreeing about the goals and the tasks.
Mm-hmm.
And the third element is preparing for the group. And by the way, if we're talking about online group, it's also preparing for the online component.
Mm-hmm.
So how do you prepare to the group? First of all, you start with the agreement, confidentiality, commitment, and all of that. So in the first group, I usually cite the main important rules, like confidentiality, commitment, and so forth. And what I usually say is, I invite you to share your thoughts and feelings. And online, I also say your body sensations, since we don't sense the body of the other. So I invite you to share your thoughts and feelings and body sensations and be present as much as you can. I sometimes say the golden rule of the group is put into words and not into actions what you think and feel.
Put into words, not into actions.
Yeah, not into action, meaning if you are anxious, don't run away, don't miss a session, something like that.
Mm-hmm. And I would imagine that within a group, there's naturally a continuum of people who have more of a facility to do that than others, right? Some people might be easy for them, and for others, okay, what do you mean put into words what I'm feeling in my body? What do you mean by that?
Yeah.
For you as a facilitator, okay, so you've done that. You've met with everyone. You're in the first meeting. What do you do? What do you say? How do you start?
So as I said, in the first meeting, what I say is that we start our group. Please bring your thoughts and feelings and body sensations into the group and focus on the here and now. That's it. That's what I say. And then I become quiet and wait.
There's that inevitable silence.
And wait and wait and wait.
Wow. Okay. And when you first started, how hard was it for you just to do that?
Oh, I see that you know the profession. Yes. One of the things is for me and for group therapists to tolerate the silence and not to become anxious that it's not working, and who knows, the group might fragment. Yeah.
Dr. Weinberg, why do you think, I mean, you've been doing this for a while. I got a couple of questions here. What keeps you going in this specialization? And also, what do you think? What do you know it is about you that allows you to be really effective at this?
Okay, what makes me continue that is that it keeps me alive. I love group sessions. Sometimes I hate them, but most of the time, even if I hate them, I love them. I mean, they are so real. People really connect. I There are so many moments of meetings, we can call them, moments of meetings where people really express how they feel, really feel that they do something for themselves and for their relationship.
Mm-hmm.
Um, so I simply feel that many times it's so powerful that I want to do it more and more.
Why is it powerful?
I think that that's one of the things that I want to increase in my life. And by the way, I think that I do that a lot also because of this expertise and because I see how people are ready to take risks and to do that. So it is powerful because people are ready to
Mm-hmm.
take risks, to become vulnerable, to become open, and to really feel the connection to other people.
Mm-hmm.
In our alienated society and divisive world and dangerous world, it's a healing experience.
Right. Yeah. It's so true. Being able to create that in that moment. I mean, you talk about risk. What is, for example, what might a risk look like in a group setting like that?
It depends, of course, on the person, but for some person, even to say, I feel close to you is taking a risk.
Mm-hmm.
Just the other day, a woman that joined the group said, I want to tell you about my family, but I feel so anxious about it because I know that it's irrational, but I'm afraid that the moment that I will tell you more, you will hurt me.
Mm,
And when she's able to do that, she's taking a risk.
right. Right. It's so true. I mean, I love the way you put that in this alienated world culture in which we're living, to experience that kind of connection with someone. When that happens, we almost take a step back. We're like, wow, this is what it's about. You feel it, right?
Yes,
Because each person is, like you said, allowing that other person to kind of see into themselves. And it could be for a brief moment.
yes, yes, yes. But it can have a tremendous impact on your life because now you know, first of all, that it is possible to have this kind of connections, and second, that you are able to do that.
Right.
Okay, so it's only a question of time and effort how to transfer it to life, actually.
Now, as a the facilitator, once you get to know these people in the group, once you become more familiar with them, are you thinking in a sense about the interaction someone might have? For example, this person and this person's interacting. Are you doing any kind of facilitation in the sense of, oh, I think, this person over here, um, did X last week, and maybe they could do Y? And are you doing any kind of that balancing act? Do you understand what I'm saying?
I hope that I understand what you're saying. So let me try and respond and tell me if I really answer you. First of all, I need to keep in mind many layers. It's very complicated, I would say. I need to keep in mind the individuals in the group. I remember things that happened to them and see if there is something that I can connect to things that happened already
Mm-hmm.
last time or before. I need to think about the individual dynamics. So, for example, if I see someone who responds to another, I need to think how do I understand it in terms of how I know this person, okay, and maybe help them see something that they have a blind spot about, okay. Then I need to be aware of the interaction. Are these people expressing hostility towards one another? Is there a conflict that is not discussed between these two people? So I need to keep in mind this layer. And then I need to keep in mind the group as a whole, meaning there is something in the dynamic that happens that is beyond one person or two people. It happens in the group as a whole. And I need to intervene and to address all these layers. So it's very complicated.
Right. Yeah, clearly. Yeah, and you did answer my question.
Okay.
I'm also interested, to what degree are you steering the
Okay.
one? Are you steering not just steering the whole experience, but are you steering an individual's experience?
All right. So first, regarding steering, I'm I'm um, I'm perceived by many um, uh, members of my group and colleagues as a provocative uh, group facilitator, meaning I can stir the pot from time to time by saying something very provocative. I'll give you a nice example, which is my cynical way when I'm frustrated. So I had a group which was a very nice group. I'm in California, and I'm talking about a group of patients from California. California is a very nice place. People are very polite, very nice to one another. And the group for months was being nice and polite for one another. And I thought that they block real, authentic expression. So at one point, I told them, "You're such a nice, nice group. I wonder what will happen when you will really allow yourself to be different. It seems as if you hide a lot inside of you." So that's a kind of a provocation. Now, regarding the individual, I can, yeah, I might sometimes stir the pot and be quite provocative. I'll give you another example, which 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 in retrospect was a little bit too much. So one group member is very detached, really. So much difficulty to talk about how he feels. He always intellectualize. He always talk about the other, not about himself. Now, one of the things that he came to the group for was about his fear of death. He is about 70 years old, and he thinks about death. And at some point, I told him, when he said something about his fear on the one hand and tried to relate to someone but did not really relate, I told him, let's call him John. "Look, John, you are dead already. I mean, inside of you, there is something dead. You don't allow yourself to connect emotionally. This is like being in a grave." Now, this is a very strong, provocative intervention. So yes, I can do that.
Wow. Well, look, I could talk to you forever. Talking with Dr. Haim Weinberg. Dr. Weinberg, look, what's the best way for people to get in contact with you?
It can be through email. Let's give you the Gmail. Haimwein, which is HAIMWEIN, N like Nancy. Okay, it's the combination of my first name and as part of my family name without a space, at gmail.com. haimwein@gmail.com.
I'll have that listed as a show notes page at the traumatherapistpodcast.com.
And if I can say, Guy, I'm going to open another new group for therapists, online group for therapists, in 2 months, I think. So I invite everyone to join.
Wow. And where can people learn about that?
On my website,
Okay.
I suggest that they will write to me and I will send them the details and the
Okay.
flyer.
Okay. Awesome. Well, look, Dr. Weinberg, I'd love to have you back at a later time. And
I'd love to be back.
An awesome guest, so inspiring. I want to thank you so much for being here. I really appreciate it.
Thank you so much, Guy. I loved it.
All right. Take care.
You too. Bye.
I want to thank you so much for listening to this podcast. And I want to let you know that I am very excited about my new podcast, The Right Now Project. The Right Now Project is about healing. It's about stepping into our own courage and authenticity and getting started or continuing along our healing process. We're all going through something, whatever it is, in this crazy life we're living. And the Right Now Project is about honoring that, celebrating that, and sharing our stories via the associated membership site. Check us out at therightnowproject.com, therightnowproject.com.